Intermittent fasting (IF) is an eating pattern that cycles between periods of fasting and eating. Unlike traditional diets that focus on what to eat, intermittent fasting focuses on when to eat. The most common methods include 1. 16/8 method. This involves fasting for 16 hours each day and eating all meals within an 8-hour window. For example, eating between noon and 8 p.m. and fasting from 8 p.m. to noon the next day. 3. Eat Stop Eat. This involves fasting for a full 24 hours once or twice a week, from dinner one day to dinner the next. 4. Alternate day fasting. This method alternates between days of normal eating and days of fasting where consuming very few calories. 5. Warrior diet. This involves eating small amounts of raw fruits and vegetables during the day and one large meal at night, typically within a 4-hour window. Benefits of intermittent fasting. 1. Weight loss and fat loss. By reducing the eating window, intermittent fasting can lead to lower calorie intake and increased fat burning, promoting weight loss. 2. Improved metabolic health. It can enhance insulin sensitivity, lower blood sugar levels, and reduce the risk of type 2 diabetes. 3. Heart health. Intermittent fasting may improve cardiovascular health by lowering blood pressure, cholesterol levels, and inflammatory markers. 4. Cellular repair and autophagy. During fasting periods, cells initiate repair processes, such as autophagy, where cells remove damaged components, promoting overall cellular health. 5. Brain health. It can increase brain-derived neurotrophic factor, BDNF, a protein that supports brain health and may protect against neurodegenerative diseases. 6. Longevity. Animal studies suggest that intermittent fasting can extend lifespan, potentially due to its effects on metabolism and cellular health. Considerations and precautions. Consult a healthcare professional. Before starting intermittent fasting, it's important to consult with a healthcare provider, especially for individuals with underlying health conditions or those who are pregnant or breastfeeding. Balance nutrition. During eating periods, focus on nutrient-dense foods to ensure adequate intake of vitamins, minerals, and other essential nutrients. Listen to your body. Intermittent fasting may not be suitable for everyone. It's crucial to listen to your body's signals and adjust the eating pattern as needed. Intermittent fasting offers various health benefits and can be a flexible and sustainable approach to improving overall well-being when practiced mindfully and appropriately.